A federal government advisory panel is recommending tonight big changes to Canada's pandemic border measures. Of note, the panel is calling for an end to the mandatory hotel quarantine for air travelers. Partially vaccinated travelers would be permitted to leave quarantine if they receive a negative PCR test taken on arrival, and fully vaccinated travelers be exempt from pre-departure testing, quarantine, and the 7-day test. We've got the primetime panel here to dig into this story, and joining us for this segment is Dr. Isaac Bogash. He is an infectious disease physician and also a member of the federal advisory panel that's making these recommendations. Dr. Bogash is in Toronto, and joining us once again, Kelly Kreiderman and Semhar Takast back for one more round. But Dr. Bogash, let's start with you because you actually helped write this. What is the idea and the timeline behind getting rid of the hotel requirement for air travelers?
Yeah, so I mean, the idea here is that, the ultimate goal here is, of course, we want to keep Canada as safe as possible. We want to have a good understanding of any virus that's coming into the country. But I think it's also fair to appreciate that we're in the vaccine era and that vaccines are rolling out quickly and that many Canadians have had a first dose. We have to have decent guidance for people that have had a first dose but not a second. And in the coming months, many people, in fact, most Canadians, will have a second dose. So our border policy has to adapt to our vaccination status while keeping us safe simultaneously. I think it's fair to say that the current policy, people can debate one way or another if it's successful or not, but it will be time to change this in the coming weeks, and we're here to get ready for that.
Yeah, and just to point it out for everybody concerned here, you can get out of the hotel requirement now by paying a fine. You're not really supposed to do that, but many people have been doing that. You don't have the same requirement at the land border. And yet, you're in Ontario, Dr. Bogash. You sit on panels for the provincial government, and that provincial government has been saying, that the Ford government has been saying, borders are a problem. We need quarantine hotels, land, air. We need them, we need them, we need them. That's the source of the problem. And here you are on a federal panel saying, we don't need them, they're not really working, and you're actually saying we could get rid of them right away. So where's it seems like a disconnect.
Yeah, well, for starters, I'm happily not in politics, and I don't need to pick sides. I could stick with science, medicine, and public health. And, I'm sure, obviously, you don't have to look too closely to see political opinions one way or another, but I think it's also fair to say that that was then, this is now. We're just recommending this. The federal government has to, absorb
right.
this and implement this at some point. But these are the recommendations. But really, these are recommendations for a country that is well into a vaccine rollout program. And I would say that's where Canada is. So if this isn't ready, this minute, as many parts of the country are in a third wave or coming out of a third wave, perhaps they'd consider this in the not too distant future, because quite frankly, we're going to be in a much better position as the weeks go on and as Canadians will likely start to travel again nationally and internationally. I think it's fair to say that the border measures have to keep up with the on the ground reality and risk. But of course, you can't sacrifice safety. And as you see, regardless of the travelers, everybody gets screened coming into the country. You have to have a good understanding of what variants are coming in, because nothing is set in stone. This can always change with time if there's risk associated with perhaps an emerging variant of concern that evades vaccination.
Yeah, and I know your report acknowledges that and said you may even have to increase quarantine times depending on what those variants of concern show in the future. I should just note that the federal government has done an initial response and just said it will continue to monitor and review all available data and scientific evidence to inform future border and travel measures. Short story is they're not saying we're implementing this right now, but as you say, Dr. Bogash, it's, they will take all of the advice that you and the rest of the panelists on this advisory group are offering. Semhar, I want to get to you quickly. What do you think? After everything we've been through in recent weeks and months, how likely are the feds to jump on many of these recommendations?
That's unclear to me right now. I worry that the feds might think that it might be too soon. And I say that because if you look at Manitoba, they're actually going the opposite way of most of the other provinces in this country. Manitoba's healthcare system is overrun. They're looking at implementing stricter measures rather than opening up. In Ontario, ICUs are still over capacity. In fact, I think they've still doubled their sort of available capacity. They don't have they've doubled the number of people in ICUs that they could comfortably manage. And so I'm curious to see what the province's reaction to these recommendations are. Look, I think most Canadians, and most people like myself included, would be happy to have restrictions lessened. I think where politicians struggle is that they understand they can't continue to open and shut down over and over again because that erodes trust and frankly it hurts them politically. So I think in Ontario, for example, the government here has understood that they have one shot at reopening next, and that's why their reopening plan is extremely cautious and more so than most of the other provinces in this country. So I think that caution might continue here in Ontario. I can see it being heightened in Manitoba, given the sort of healthcare situation there with the pandemic. I'd be interested to see what the other provinces have to say about these recommendations.
Kelly Kreiderman, I am certainly cognizant that people listening to these recommendations tonight, those craving visiting family abroad or bringing family from abroad, or dare I say going to a beach or something like that, might be jumping for joy on this. Your take?
I think this report is very good in that it recognizes we're headed towards vaccination. And it even offers a reward for people who are fully vaccinated in that they do not have to quarantine at all. But, I go back to January or February when this policy was implemented. I thought it was a very good thing because it would disincent people from traveling. The problem that I think this report points out very well is the inconsistencies in the program, the fact that you didn't have to quarantine at all if you're crossing a land border, the fact that you can pay a fine and leave earlier, the fact that we know from news reports, not the report itself, news reports that it has not been always enforced in any regular way across the country. I think an examination of our policies as it relates to international travel is really important at this time, not only to get back to some semblance of normal life if we're vaccinated, but also to make sure that if there is any concern about variants coming into the country and whatever the levels coming in from outside of the country, we know it plays a role in new infections, that it gets a thorough reset and the government takes a relook at its policies instead of reflexively referring to the quarantine period as having just dealt with the international cases problem, which I don't think I think we've learned that's not a particularly good answer.
Dr. Bogash, we've got about a minute left, but I want to give you an opportunity to respond.
I think those are all very valid points that everyone brings up. I think the other point that is very well taken is that this is not for implementation tomorrow, as we hear that many parts of the country aren't ready for this. But we have to be prepared, right? Things are rapidly improving in much of the country. The border measure will come up again, at least with the Canada-U.S. border, sometime in late June. I mean, this is something maybe that we'll see implemented, or something close to this, some movement on the border implemented perhaps in the month of June, later on in June, where things should be much better off across the country, given the widespread vaccine rollout.
Well, okay. And Dr. Bogash, I will just reiterate for those watching and listening that these are recommendations that have come out. Nothing is changing immediately. The federal government is not adopting these ASAP, but it is a recommendation from the expert panel that the way in which the border reopening would look. To the three of you, thank you so much for your thoughts, your insight. Appreciate it.
My pleasure.
Thanks for having us.
Have a great night.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.